What are Emery-Dreifuss muscular dystrophy symptoms? Emery-Dreifuss muscular dystrophy, often referred to as EDMD, is a specific type of muscular dystrophy that presents a unique set of symptoms. Understanding these symptoms is crucial for early diagnosis and management. The condition is characterized by a distinct triad of symptoms: early onset joint contractures, progressive muscle weakness, and cardiac abnormalities. These symptoms typically begin to emerge in childhood or adolescence, often around the age of 10. One of the earliest signs of EDMD is the development of joint contractures. These are the tightening and shortening of muscles or tendons around joints, which can limit movement. Commonly affected areas include the elbows, ankles, particularly the Achilles tendons, and the neck. This can lead to difficulties in fully straightening the arms, walking on toes due to stiff heels, and limited forward bending of the neck. Notably, these contractures can appear before significant muscle weakness develops, which sets EDMD apart from other muscular dystrophies. As the condition progresses, muscle weakness and wasting become more apparent. This weakness typically starts in the upper arms and lower legs, a pattern known as humeropronal weakness. Individuals may find it challenging to raise their arms above their heads or walk on their toes. Over time, the weakness can extend to the thighs, hips, neck, shoulder girdle, and forearms. While facial muscle weakness can occur, it is usually mild. Muscle wasting leads to a noticeable reduction in muscle mass and strength. Another serious aspect of EDMD is cardiac involvement. Heart problems can manifest as arrhythmias, which are irregular heartbeats, conduction defects, and cardiomyopathy, a disease of the heart muscle. These cardiac issues can lead to fainting spells and increase the risk of sudden cardiac events. Symptoms related to the heart often become detectable by early adulthood but may appear earlier in some cases. It is also important to note that female carriers of X-linked EDMD may face cardiac complications, even if they do not exhibit muscle symptoms. In addition to these primary symptoms, some individuals with EDMD may develop scoliosis, which is a curvature of the spine, and rigidity of the spine. However, it is reassuring to know that intellectual function remains typically normal in those affected by EDMD. In summary, Emery-Dreifuss muscular dystrophy is characterized by early joint contractures, slow progression of muscle weakness primarily affecting the upper arms and lower legs, and potentially serious heart abnormalities. These symptoms highlight the importance of early diagnosis and ongoing cardiac care. If you or someone you know is experiencing these symptoms, it is essential to consult a healthcare professional for personalized advice and management.